for his time of questioning.
Thank you, Mr. Chairman. Artificial intelligence has potential for expanding access to healthcare and improving patient care. However, as with any new or developing technology, we need to make sure that we are evaluating any potential harms and ensuring appropriate safeguards as the technology continues to expand. It is crucial to directly address the risks, including mental health risks, that AI tools may pose for our children. Dr. Wright, in your testimony, you discussed the need to protect vulnerable populations like youth. You stated that, quote, AI systems designed for adults are not necessarily appropriate for youth. Could you please explain what specific dangers and potential harms AI technology used for healthcare can have on children and their development?
Thank you so much for the question. So I think when we think about the model, right, it's really about representativeness and ensuring that whatever training model we're employing has been trained on the data that's appropriate is critical, because you do end up seeing these harms when you've got systems that were developed for adults, and children are not just little adults. They have very different developmental trajectories. What is helpful for one child may not be helpful for somebody else, not just based on their age, but based on their temperament and how they have been raised. So, you know, at worst, some of the harms we're seeing have been, you know, alleged completed suicides, and also suicide attempts, and suicidology discussions with different types of chatbots. You've seen, as I mentioned in my testimony, there is a case in Texas where a young individual, following the validation and advice from a chatbot, attacked his family and had to be hospitalized. So the harms are real. We also have positive use cases on top of it, right? So I hear stories of children who use a chatbot to practice their social skills so that they can make a new friend at school. It's not an all good or an all bad thing. It's about how we use the tool appropriately, how we safeguard it, how we test its effectiveness to ensure that children who are going to continue to use these AI tools, because they're not going away, will be protected.
You know, I too am alarmed at stories of individuals turning to AI chatbots as a source for therapy, including the tragic story of California teenager, Adam Rain. ChatGPT provided mental health resources when Adam shared his suicidal ideations, maybe a pop-up or something which is inappropriate in a clinical setting. Imagine you're admitting your suicidal thoughts and the clinician just holds up a poster board with a hotline number and then continues with more deep conversations about how to actually complete suicide. So it's completely not clinically appropriate or that helpful. Dr. Wright, if AI systems can behave unpredictably, what enforceable guardrails are needed to ensure that they do not worsen crisis or harm individuals, especially those seeking mental health resources? And what benchmarks must be met before AI can be responsibly scaled as a tool for mental health support, especially for youth?
Well, I think at first we have to ensure that these tools do not misrepresent themselves as licensed professionals, that they cannot call themselves psychologists or psychiatrists or social workers, because that gives a sense of credibility that doesn't exist. I think on the back, the real expertise for these products are on the back end. They're how they're being coded. And we could encourage companies to make them less addictive in their coding tactics and make it so that user engagement isn't the sole outcome that they are trying to achieve. I think some of those things would also help. We could also ask for specific audit and reporting requirements where these companies had to actually disclose anytime they detected suicidology or attempted or completed suicides. We could have better age verifications and age restrictions. I think there are some pretty low-level things that we could do that would actually ensure that these tools are used better. We also just need better tools.
And what can we do to educate clinicians on how to use these?
Well, I think for sure clinicians need a lot of education on how to use these. I think part of why you haven't seen adoption is the anxiety and the fear that these tools bring, and the lack of understanding of how they work. So I think helping providers know what works, what the limitations of these tools are, is first step towards helping them decide whether or not they want to choose to implement them in their practices.
Thank you. I yield back.